Good morning, everyone. I'm Dr. Rameshwar Reddy, consultant cardiologist at Udayananda Hospitals, Nandyal. So, today's topic is hypertension in young adults. The onset of hypertension in less than 40 years of age is called hypertension in young. There are so many causes for hypertension young. We need to evaluate for the secondary causes of hypertension before starting a treatment. So these set of patients, we need to check their body mass index, we need to check their thyroid status, and there should be a strict control of diet and physical activity, and also there are some genetic conditions which they can be predisposed for hypertension in young. So we need to evaluate any patient who comes with hypertension, uncontrolled BP less than 40 years of age. First, we need to look into secondary causes of hypertension, because early detection and treatment of secondary causes can prevent end organ damage. So we need to be evaluating these patients for secondary causes, and also renal problems, very importantly. So they should be, the evaluation includes even the kidney evaluation for secondary causes in the form of renal arterial Doppler. So we need to check their creatinine, renal function test, any proteinuria, any hematuria, so to rule out any secondary causes of hypertension, renal causes of secondary hypertension. Any young patients who comes with uncontrolled BP, most of the hypertensive emergencies, BP will be more than 130. So there should be immediate control of hypertension to prevent end organ damage, and also we need to see if there is any hypertensive retinopathy, hypertensive nephropathy. So we need to check and evaluate properly any young patient less than 40 years with uncontrolled hypertension to look for secondary causes and treat accordingly. Very importantly, maintaining restricted salt diet, avoiding junk food, regular physical activity, maintaining normal body mass index. Most of the hypertension can be controlled before starting medications. In spite of physical activity, diet control, salt restriction, in spite of these measures, still BP is more than 140 and actually more than 90. We have to consider starting them on medications. And also they should be on a regular follow-up with the doctor, keeping the BP under control, and also managing stress and having an adequate rest in the form of sleep, sound sleep. We can reduce or we can maintain or manage hypertension without having it affects one of our organs. Very strict salt control and regular physical activity and maintaining an adequate or normal body mass index can reduce hypertension nearly up to 10 mmHg. So apart from all these measures, in spite of all these measures, if BP is more, we need to start them on medications. Before starting on medications, we need to rule out all the secondary causes of hypertension in these young males and females. They should have a regular follow-ups with the doctor.